Every year, home health agencies lose millions of dollars in Medicare denials. And most of the time, it's not because the patient didn't need a nurse, it's because the nurse used one of these 5 trap words. If you're using AI voice narration or charting software, these words are even more dangerous because the AI will document exactly what you say and a reviewer will see a red flag instead of a skill visit. Today, we're doing a Medicare Denial Audit. I'm giving you the 5 words you need to delete from your nursing notes immediately and what to say instead to prove skilled need. Word number 1 is stable. I know we use it all the time, but in home health, if a patient is stable, Medicare thinks they don't need you anymore and they're stable. Why is a nurse being paid to be in the living room? This is the shift. Instead of patient stable, describe the compensation. Say this: patient's clinical status is currently compensated. However, continued nursing monitoring is required due to high risk of a specific complication like CHF exacerbation, for example. Word number 2, independent. This is a homebound status killer. If you document that a patient is independent with ADLs or ambulation without adding context, you're telling the reviewer they don't need the criteria for home health. This is the shift. Focus on the safety risk or the assistive device. Say this: patient ambulates independently within the home using a rolling walker, but requires skilled assessment of gait fatigue to prevent falls due to taxing effort to leave the home. Word number 3, routine. Never call your visit, your wound care, or your assessment routine. Medicare does not pay for routine care. They pay for skilled care. So the shift on this is use skilled. Say this instead: perform skilled nursing assessment of, for example, a specific system like heart failure or respiratory failure to identify early signs of decline. There is nothing routine about your clinical judgment. Word number 4, observed. This sounds passive. A neighbor can observe a patient. A nurse assesses. So the shift here is use assessed or evaluated. So say this instead: evaluated patient's technique for insulin administration to ensure safety and dosage accuracy. This shows you are not just watching, you are analyzing. Finally, word number 5, monitoring. This is the biggest trap of all. If you just say that you are monitoring vitals, a reviewer will say a medical assistant or a family member could do that. So the shift here is tell them why you are monitoring. Say this instead: skilled monitoring of blood pressure performed to evaluate the effectiveness of new hypertensive medication and assess for these adverse side effects. Documentation isn't just about what you did, it's about proving why it required a nurse to do it. When you use AI charting, remember, the AI is your scribe, but you are the clinician. If you feed it stable and routine, it will give you a denied note. If this audit helped you, help this by hitting the subscribe button. I'm building this channel to help us all chart faster and protect our licenses. And if you want a full 7-step script for narrating a perfect visit, watch this video next. It's right there on the screen.